Hi, Professor. Hi, everyone. This is Amara Olibu again, uh, a student of United States University, and this is a class of FMP 597. And this is my presentation for the final soap notes. I'm very excited for this. So, this week, um, presentation or case is most memorable patient I encountered this week. And this patient is a 6 year old male with attention deficit hyperreactivity disorder. The patient was accompanied by both parents. They adequately described the symptoms that have been affecting their child. Mother reported that they say noticing all the symptoms when the child was about 2 to 3 years old, but didn't really take it seriously. But still having concern when behavior is affecting patients' academic performance, social life, and social life and others. This case interested me because I wanted to establish the cause of the symptoms to help the child and also enhance the skills and knowledge required to provide care to mentally ill patients. As stated before, my patient is a 6 year old Caucasian male. Patient initial is EM. No past medical history per the mom. No past surgery, no past hospitalization. Preventive care patient has been up to date with his immunization. Last immunization was DTaP, the fifth dose in October 2022. So, family history includes paternal grandfather, 61-year-old, has hypertension. Paternal grandmother, 58-year-old, is obese. Maternal grandfather is 57-year-old, has history of ADHD. Um, Maternal grandmother, 53-year-old, has diabetes. And mother is 31, has history of PTSD. Uh, father is 31, has history of PTSD, and mother no significant health issue. Patient has a 4-year-old brother, denies any past or current health issues. So we'll go straight. Patient patient is otherwise healthy. All rows are within normal condition. Patient, as stated by parents, um, birth patient birth has there was no complication during birth of patient. Patient sleeps well, has no significant issues. Um, so objective patient vital signs are pretty stable. Blood pressure is heart rate is 90. Blood pressure is 110 over 58. Temperature is 98.6. Respiration is 18. Pulse ox is 98. Patient height is 46 inches. Weight is 48 pounds. BMI is 15.9. Patient is, as stated before, patient is pretty much stable. No issues going on. So I'm just gonna jump to my assessment, which is my differentials. My first differentials is attention deficit hyperreactivity disorder, ADHD. Oh, before that, mother um, mother has presented that patient has been very uncontrolling. Patient cannot stay on one particular task for a short period of time. Patient is very forgetful. Patient does not listen in class. According to the mom, uh, patient school teacher has called countless times that patient is very disruptive in class, non-unrolling, non-abiding. So My first differentials, as stated before, is ADHD combined. ADHD affects children's ability to function, according to Magnum's et al. 2020. Based on the gathered data, both subjective and objective, the patient meets at least six symptoms of predominantly inattentive and predominantly impulsive or hyperactive ADHD. Therefore, his condition is ADHD, a combined type. Symptoms of ADHD predominantly inattentive documented includes trouble organizing tasks and poor concentration while fidgeting and trouble waiting for his turn are examples of hyperreactive and impulsivity. ADHD is also present in the significant family history. So that is why these HD, ADHD is my number one differential diagnosis. So my second differentials is specific learning disability. Learning disorder is the leading differential diagnosis of ADHD, according to Belarja et al. 2018. According to the DSM-5, a child is diagnosed with this disorder when they show persistent difficulties in reading, writing, or mathematical reasoning skills during formal year of schooling. A child's academic skills must also be below the average range of SOURCE when compared to the standard by according to Domingos and Kapnong 2020. Additionally, these difficulties begin during the school years, although the parents report that the child's academic performance has dropped. This diagnosis is ruled out because the parents deny that the patient experienced difficulty comprehending information at school or at home. My third diagnosis is optional deviant disorder. ODD is also one of the leading differentials for ADHD. The DSM-5 diagnostic criteria for ODD provide 8 symptoms that may be manifested by children with this disorder. A child is diagnosed with ODD if they meet at least 4 of the 8 symptoms. These symptoms centers around angry or irritable mood, deviant behavior, or argumentative and vindictiveness. This order has also included the list because the parents report that the child is deviant. Include in the list because the parent report that the child is deviant at school, especially when asked by the teacher to sit down. He also deliberately interrupts or annoys others. ODD is, however, ruled out because the patient does not meet other symptoms as outlined in the criteria. So my final diagnosis based on the gathered data, ADHD combined type is the primary diagnosis for this patient. The patient meets at least 6 symptoms for each other type of ADHD. Additionally, he has a significant family history of ADHD. So my plan for this diagnosis, no specific laboratory or radiologic tests are used to diagnose this disease. Therefore, clinician must must build a comprehensive patient history to diagnose the disorder. Although neuropsychological tests exist, they are not as sensitive as detailed patient history. Mag Magnus et al. 2020. Kanner's rating scales was used for this case. It will help to rate the symptoms and rule out comorbidity conditions such as ODD by Cabral 2020. So treatment include current clinical practice guidelines recommend a combination of pharmacological therapy, preferably stimulants, which is metfeminide, 54 milligram per day in the morning, to be titrated based on efficacy and tolerability of this patient, and parent and patient training in behavioral management. Education. Educate the parents about so I will educate the parents about the side effect of the medication, such as decreased appetite and sleep for the drugs. I'll provide education about this mental issues to the parents, emphasize the effectiveness of stimulants and the need to comply with the treatment. I'll connect parents to community resources and support group to provide stimulation issues. So there will be a follow up in 2 weeks to assess compliance with medication and response to plan of care, and to find out if there's any adverse effect of the medication, just to ensure if the patient is tolerating the medication well. So the holistic approach and caring science, collaboration and cultural consideration. So for this, just like in other common mental disorders, strong collaboration between the healthcare team and patients/families and disciplinary collaborations are needed to improve outcomes in patients with ADHD. Magnus L. acknowledged that ADHD is not only highly stigmatized in society, but also patients/family do not trust the drugs and often seek alternative treatment. In this case, I would actively cultivate to collaborate environment with the parents and other healthcare members to ensure that patients adequately understand what ADHD is and the available evidence-based intervention. Some healthcare members that would be included in the clinical encounter include pharmacists, psychiatrists, and pediatrician. Application of Jane Watson caring process. Watson human caring theory creates a caring healing environment. The caring process that was considered during this clinical encounter is nurturing or developing a helping, trusting relationship. It is common for parents to get worried about their children's health, more so when they are diagnosed with new condition. Therefore, there are needs to cultivate a human to human connections out of love and compassion to create a connective environment where the parents could understand their child's condition in a non-judgmental manner. This process was instrumental in helping the parents to ask several relevant questions about the disease, treatment options, and potential future outcomes of their child. A holistic care/slash approach, nurse practitioners should provide support to patients and families that consider the whole person, not just physical or mental health. This clinic clinical encounter is considered a holistic approach. The parent, for instance, will engage in the various aspects of life, including social, financial, and intellectual, environmental, psychological, and spiritual. So, in conclusion, this was an interesting yet challenging case for me. As a family nurse practitioner, I should be able to provide the care to patients and across the lifespan presenting with different health issues. I learned important items from this case. I learned that when dealing with patients presenting with mental behavioral issue, one must gather detailed information that includes significant family history and pregnancy or birth events. I also learned that clinicians can explore different reading skills to determine the severity of symptoms. The skills and knowledge acquired here will be useful in my clinical rotation and practice. This brings to the end of my presentation. Thank you very much, Professor. Thank you, my fellow students.